What I'd like to talk to you about today is one of the most important topics facing patients in our country today, and that is the topic of sudden cardiac death. What that means is, for patients, is that anyone with heart dysfunction of a certain degree, meaning if your heart is weak for whatever reason, whether it's because of a previous large heart attack, whether it's because your heart is weak because of a virus that you had years ago, if your heart pumping function is weak, you are at risk for having a dangerous heart rhythm that could be lethal. Fortunately, we have therapy today that can cure this problem and save hundreds of thousands of lives when appropriately delivered. And that is a defibrillator. As many of you know or have seen, patients who have sudden cardiac arrest or patients who pass out and the ambulance comes and they get shocked in the chest, what people call blue code, that type of thing, you may have seen it in the movies. That type of problem kills more patients in the US today than all cancers combined. And fortunately, we can prevent that from happening in a large number of patients with an ICD. An ICD is a defibrillator. It's like a pacemaker. It's a very small device that is inserted under the skin, under the collarbone, and there are wires that are threaded from the device to the heart. Such a device can shock the heart within seconds and save your life if you have one of these dangerous rhythms. People who are predisposed to having this are patients who have an ejection fraction that is less than 35%, which means normally the heart pumps about 60% of what comes in is pumped out. In patients who have weaker hearts, where only 35% or about half of what is being pumped in is being pumped out, they are at risk for having these dangerous heart rhythms. And a simple procedure like this can be life-saving. It is more important than medicines that we use for heart failure. And in fact, even patients who feel fairly well in the status of a weak heart are still at risk for having these dangerous heart rhythms. There are certain ICDs that have an additional component for treating patients with severe heart failure, and that is a third wire besides the upper and lower chambers of a standard defibrillator that can actually pace the left side of the heart and improve heart function. So besides the therapy of shocking your heart out of a dangerous heart rhythm, this third wire can pace the left side of your heart and improve your heart function and potentially make you feel much better as well.